Pretty soon there could be more coronavirus vaccines available for more younger children. Joining us today is Dr. Christina Johns. She is a pediatric emergency medicine physician and also senior medical advisor at PM Pediatrics. Dr. Johns, thanks so much for being with us this morning.
Thank you.
Dr. Johns, the Pfizer vaccine is already available for kids as young as 12. A few weeks ago, the pharmaceutical company Moderna applied for emergency use authorization for its vaccines in kids as young as 12 as well. First of all, do you expect that application to be approved, and what would that mean for the vaccination process?
I do expect that it will be approved. The the safety and effectiveness data looked quite good when it was released. And so I do anticipate that that will be coming out soon. And I think that that's great. If there is yet another option to make vaccines more accessible for the younger population, I think that's good news and gets us close to the goal of ending this pandemic.
PM Pediatrics is the nation's largest pediatric urgent care center. Dr. Johns, can you comment on that advisory that came out from the CDC about myocarditis cases possibly related in younger people to these vaccines?
I sure can. You know, this is an excellent example of the safety monitoring system working. When there is a safety signal, as there was, it was noted, evaluated, and examined very closely. And the advisory committee to the CDC examined these cases very closely and found that while the good news is that those kids who had this effect, number one, it's very rare. Number two, the cases of myocarditis were all quite mild with excellent recovery. So I think that that's important to know because it's important to put this in context with a risk-benefit consideration about the vaccine. We know that there can be some serious heart effects that can happen from getting COVID-19 infection. And so it's important to remember that when you consider or not whether to get your child the vaccine. That at this point, what this committee has concluded is that the benefits of getting the vaccine outweigh any potential rare risk. And I think that's really important to lean into the science on that.
And while that discussion is going on these past couple of weeks, the CDC is starting to see hospitalizations of teenagers on the rise in connection with COVID-19. Why do you think that might be happening right now? And how concerned should parents be about that, especially with some kids, of course, kids younger than 12, still not eligible to be vaccinated?
Well, I think that it is important to be very aware of the numbers and the trends. The pediatric community isn't terribly surprised that there are more younger people, teenagers and younger kids who are getting COVID-19. They are the vulnerable population right now. They are a larger percentage of the people who are testing positive because they are the ones who either aren't eligible for the vaccine yet or aren't able or haven't gotten the vaccine. And so with a more highly transmissible variant, the Delta variant, starting to circulate, it is no surprise that the population that is going to likely be most affected and is starting to be more so are younger people. And so all the more reason why we need to get everyone vaccinated and protected.
Yeah, Dr. Johns, it flows from that statement then about potentially kids younger than 12 needing to be or should be vaccinated. When do you expect that might happen, and what would need to happen before the vaccines could be available for that younger age group?
So we're all waiting for the next set of safety effectiveness and dosing data it should be coming out. We're anticipating, based on what we're getting from the manufacturers, that may be in the fall or so. So do I think that the vaccine will be ready for the elementary age group school kids by the start of school? Probably not, but I think sometime this fall. And it is going to be very, very important to get this group vaccinated and protected as well.
Okay, Dr. Christina Johns from PM Pediatrics. Just one more chance for you here to weigh in on the decision and some parents on the fence who deciding whether to get their kids vaccinated. What do you say to them?
I would really encourage any parent who has concerns or hesitations, speak to your own child's pediatrician. he or she knows your child the best, and it's their job to curate the masses of information that is that's out there that can be confusing and concerning at best. So make sure that you speak to your child's pediatrician. He or she can help you sort through all of the information to determine what is real, what isn't, and what is the best choice for your child.
Okay, Dr. Christina Johns from PM Pediatrics, thanks so much for doing that for us this morning. Okay, that does it for us. Thanks for watching. And for more information, go to the website wmar2news.com.